Hello, my name is Morgan. I will be your nurse practitioner today.
Hello, Morgan.
Can you tell me your name and birthday?
Trent Pashik. My birthday is 10/04/96.
Nice to meet you, Trent. What brings you in today?
I'm getting my annual physical.
Okay. And do you have any problems you want to talk about, like any symptoms bothering you today?
No,
Okay. What medical history do you have?
none.
No medical problems?
No.
Okay. Does anyone in your family have medical problems? Your parents, siblings, grandparents?
No, seem to be pretty healthy.
Okay, that's good. Have you ever had surgery before?
Yes, I've had shoulder surgery.
Okay. Did you have an injury?
Yes,
Okay. No problems with the shoulder today?
no problems.
Okay. Any pain at all?
No pain.
Okay. Are you allergic to anything?
I am not.
Any medications or seasonal?
No, just
Stuff.
regular allergies throughout the year.
Okay. What's your diet like?
Pretty good diet. Try to eat healthy when I can.
Okay. Do you exercise regularly?
I do.
Okay. Do you drink alcohol at all?
No.
Okay. Any drug use, marijuana, tobacco,
No.
anything like that?
No.
Okay, good. Are you up to date on all of your immunizations that you're aware of?
I am.
Okay.
Yes.
You've had the Tdap within 10 years and then your influenza vaccine
Yes.
for the flu season this year?
Mm-hmm.
Good. I'm going to ask you what feels like a lot of questions, but I'm just going to kind of go through each body system and ask if you're having any symptoms related to that system. So you can just tell me yes or no.
Okay.
Do you have any headaches?
No.
Any dizziness or lightheadedness?
No.
Okay. Any trouble with your vision?
No.
Okay. Do you see an eye doctor regularly?
I do.
Okay. Any problems hearing?
No.
Any pain in your ears, discharge from your ears?
No.
Okay. Any nasal congestion?
No.
Excessively? Okay.
No.
Any pain in your mouth?
No.
Difficulty swallowing? Okay.
Mm-mm.
Any tenderness in your neck?
No.
Okay. Any joint pain or tenderness?
No.
Okay. Do you have a hard time breathing ever?
No.
Do you ever feel like your heart is racing in your chest?
No.
No chest pain?
No chest pain.
Okay. Any abdominal pain?
No. No pain.
Okay. Do you have regular bowel movements?
I do. Yep.
Okay. Every day?
Yep.
Okay. Any painful urination?
No.
Okay. Are your legs weak when you stand? Do you feel like you have a steady gait?
Yeah, pretty steady. Yeah.
Okay. No falls or anything
No.
like that? Okay. Any unexpected weight loss or weight gain?
No.
Okay. Any intolerance to cold or heat temperatures? You
No.
feel like it's normal?
They're pretty normal.
Any excess sweating on and off throughout the day?
No.
Okay, good. I'm going to go ahead and obtain Trent's vital signs. His blood pressure is 120/80, heart rate is 72, respiratory rate is 16, temperature is 98.6 degrees Fahrenheit, pulse oximetry is 98% on room air. He is 5 foot 10 inches tall and 180 pounds, so his BMI is 28.4. Upon observation, Trent is well kept. He's awake and alert. His thought process and his mood are appropriate to the situation. His affect is flat, normal to the situation. There are no visible lesions on the skin. Skin turgor is normal. There is no diaphoresis, edema, and the temperature is warm. And there's no excessive erythema or pallor. And for the next portion of the exam, I'm going to palpate your scalp. There is hair present, there's no visible deformities or lesions, and it is symmetrical on both sides. I'm going to touch my fingers to each side of your face, and I want you to tell me if the sensation feels the same on both sides.
Yes. Yes. Yes.
Good. And then please puff your cheeks and raise your eyebrows. Good. So cranial nerves 5 and 7 are intact. We did assess cranial nerve number 2, visual acuity, with the Snellen chart outside the room, and Trent's vision is 20/20 in both his right and left eyes. So I'm going to start by having you follow my finger with just your eyes. Good. So cranial nerves 3, 4, and 6 are intact on the extraocular eye movements. Please remove your glasses. I'm going to just inspect the eyes. There is no drainage or crusts. Conjunctiva are pink and moist. Any pain or tenderness in the eyes?
No.
Good. You can just look at my nose. I'm going to assess your pupils. Good. Pupils are equal round and reactive to light. I am now going to take a look at your cornea. Just shine a bright light in your eye. Optic disc is sharp and vessels are present. And again, optic disc is sharp and vessels are present. Before I assess your ears, I'm going to perform the whisper test, which is evaluating cranial nerve number 8. So I'm going to stand on each side of you and whisper a word, and I want you to say out loud what the word is that I whispered.
7,
Good.
10,
Good. Any pain or tenderness when I palpate your ear? Good. There is no crusts, erythema, redness. And take a look at your inside your ear. Tympanic membrane is pearly gray. There is no erythema or excess wax. No pain or tenderness when I palpate this side
No.
either. Okay. And tympanic membrane is pearly gray without excess erythema or wax. And I'm going to take a look inside your nose. Nasal turbinates are patent. Mucosa is pink without excess drainage. I'm going to have you cover one nostril and smell, and the other side as well. Good, so that's assessing the olfactory nerve, which is cranial nerve number 1. Please open up your mouth and say ah. Good, tonsils are intact, dentition is intact, mucosa is pink and moist. Please stick your tongue out and move it side to side. Good, and then I'm going to feel in your throat for a swallow for me, please. Good, so cranial nerves 9, 10, and 12 are intact. So now I'm going to assess your neck. There are no visible pulsations. The trachea is midline. I'll start by palpating your lymph nodes. Good, there is no lymphadenopathy. I'm going to stand behind you and palpate your thyroid. There are no nodules. I'm now going to place my hand on the side of your head, and I'll have you turn towards my hand against the resistance. Good. This is assessing the strength of the sternocleidomastoid muscle and also implying that cranial nerve number 11 is intact. I'm now looking at your chest. There is no visible pulsations. I'm going to palpate for the point of maximal impulse of your heart. Good. Midclavicular line in the 5th intercostal space. I'm now going to take a listen to your heart and lungs. I'm going to start with your heart so you can just breathe normally. Now I'll have you take big deep breaths. Good. Good. Have you rotate the chair. Big breaths again. One more time. Good. Breath sounds are equal and clear bilaterally, and I hear S1 and S2 heart sounds without any additional heart sounds. And now for the abdominal exam, I'm inspecting your abdomen. It is round, it is not concave, and there are no visible pulsations. I'm going to go ahead and listen to all 4 quadrants for bowel sounds. Good. Bowel sounds are normal active in all 4 quadrants. I'm now going to palpate. Let me know if you have any pain or tenderness. No pain there?
No.
Good. For the next portion of the exam, I'm going to have you walk to one side of the room and then turn around and walk back, please. Good. Steady gait, no abnormalities. Now I'll have you relax with your hands to your side, feet shoulder width apart, and go ahead and close your eyes. We're performing the Romberg's test. There is no swaying, so this is a negative Romberg's test. Good. So we're now going to evaluate the range of motion of each of your joints and then the strength of your upper and lower extremities. So start by raising your arms all the way above your head. Good. And then down and back behind you as far as you can go. Good. Go ahead and bring your arms up to the side and then cross your arms in front of you. Good. And while your arms are out in front, go ahead and flip your palms up, supination and pronation, and back down. Good. You can relax your arms. Now I'm going to place my hands on your shoulders and go ahead and rise against me. Good. So strength is 5 out of 5 in the shoulders. Moving on to the elbows, go ahead and put your arms out again for me, and we're going to flex the elbows and extend the elbows. Good. And then again, the supination and pronation, go ahead and flip your palms down and then up, and then I'm going to feel the strength if you could flex your arms against me. Good. Strength is 5 out of 5 in the elbows. We're now going to evaluate the hip. So go ahead and raise one leg out to the side and the other side the same thing. And then we're going to flex by raising the leg in front of us and then straightening it behind you is the extension. Good. Go ahead and do it on the other side as well. And the extension. Very good. You can have a seat. I'm going to raise the recliner and we're going to evaluate the range of motion of your knee. So go ahead and bend your knee up towards your chest for flexion of the knee and then extension and down. Good. And on the other side, the same thing. Flexion, extension, and down. Good. I'm now going to feel pulses. So we'll start with the radial pulse, which is 2+. Great. I'm going to also check capillary refill in your fingers. Good. Capillary refill is less than 3 seconds in all of your finger beds. With your hands out like they were, please flex the wrists down and then extend them up. Very good. And then moving on to your ankles, the same thing. I'll have you flex your feet towards the ground and then raise them back up towards you. Very good. We're going to feel dorsalis pedis pulse, which is 2+, and then the posterior tibial, which is also 2+. Good deal. So go ahead and we'll close the recliner now of the chair. I'm going to start by having you push your legs out towards me. Good. Strength is 5 out of 5. And now we'll evaluate reflexes. Good. Good. And then the biceps reflex, you can relax the weight of your arm all the way onto mine. Good. And lift it up to the side. Go ahead and relax that arm right all the way into mine. Good. Good. And the other side. Same thing. Into the biceps, relax into my hand. Good. And then the triceps. Relax into the weight of my hand. Good. Okay. And that completes the exam.